Emergency medicine was more my pace. Trained in family medicine, but which encompassed a lot, which allowed me to have that broad spectrum of knowledge. And you're just kind of incorporating more of the emergency aspect, which is pretty intuitive, at least for me it was. And I think there are things that help me do a little better than others is in family practice. I mean, they push you towards, of course, good bedside manner, being able to deliver a baby all the way to a 90-year-old geriatric, going into a nursing home. So having all that background, and then of course the emergency medicine has become pretty much primary care as well. I mean, it's when you ask patients who your doctor is, they usually name the ER doctor, which isn't right, but unfortunately that's where they get their care. So I think that primary care aspect really helped me to be where I am. But mainly I think it's the going someplace where people need you and then just able to help out the community.
What kind of got you into being interested in locums and kind of the travel stuff?
Yeah, I guess I attribute that mainly to my wife, who's willing to allow me to go travel. You miss your family when you're away, but you do get that downtime where you can just focus on your work. I think it worked great for me. First off, my wife being, very independent as she is, allowed me to go ahead. And now I'm almost going on 7 to 8 years of doing that. She's been a rock at home, kind of handles a lot of stuff and allows me to just focus on my work. Traveling, it's always been fun for me. Seeing the different communities and working with different people and getting in, whether it's Midwest, whether it's Southeast, haven't really gone out to West much, but I'm sure there's different cultures and different vibes, which keep it all very interesting and fun. Thanks to the teams that you have that allow me to at least, you guys can fill in a lot of stuff and keep track and keep me in line of all the documents and everything that I have to submit. Some things that I was used to doing on my own most of the time. Applying for my own DEA, applying for the license and all that stuff was a bit of a legwork. When you have like with you guys and like Elizabeth Sosa, who's been great, all those things are pre-filled and just kind of takes away my time of spending hours trying to fill in the same thing for everybody, every application that comes, on our desk. That's why I kind of like you guys definitely more than others, because there is that support that normally we don't have. When you have that kind of support, I'm like, all right, Brendan, where are we going next? I trust you. That says a lot because, I usually want to know 10 million details before I jump in and do an application, do a license and all that. So if you tell me, hey, this is what we got, and you kind of outline it pretty well where I do want to go ahead or not. And then when I'm on. With Aequor, you guys have delivered on every aspect of what the site is about. And if there's something I don't like, you want to hear about it, you're going to do something about it. Glad to have that kind of support and attention.
Having been in locums for a while, do you have just kind of any advice for physicians that be considering doing locums work?
Don't rush into things because you feel like you need to do something. Be patient, build relationships, and just go and work hard. You can only benefit from working hard. Word will spread, people will recognize things and your efforts, and then they're going to point you to other jobs and other areas. The first time was kind of, wide-eyed, bushy-tailed, and just whatever I'm, need to do, I'll do. I've learned a lot. So I think each hospital I walk into, patients are patients. They're going to have abdominal pain and chest pain, and they're going to come in with a stroke or a heart attack. But it's the staff that you're working with and the resources you have and the administration that you're under over there. And if you can work with it and learn from it, each place as you go actually gets easier and easier. I'm not afraid of walking into some new place. Just show me how to do the EMR and where the bathroom is, and that's all I really need, and where I can get coffee. And then you just kind of, start running and seeing patients. I think over the years, all that has been cumulative. All my experiences just kind of falling back on that all the time.